Now we're talking to Sharon Lane, who is the CEO or Chief Executive Officer of Dyspraxia Ireland. Sharon, you're very welcome to Disability Matters.
Thank you, John. It's a pleasure to be here with you this morning. I really appreciate the opportunity.
It's our pleasure. You might start by just telling us a bit about dyspraxia. I'm sure people want to know what it is and what the symptoms are.
Absolutely. So, dyspraxia is the layman's term for a condition called developmental coordination disorder, also known as DCD. And it is a condition that affects fine and gross motor skills in both children and adults. So, if you can think about fine gross motor skills as things such as threading a needle, writing, cutting with a pair of scissors, tying your shoelaces, they would be fine motor skills. So dyspraxia would impact on your ability to undertake those activities. And then with your gross motor skills, there's an exercise I like to ask people to do, which is to stand on one leg and just look at how you balance on one leg, and then stand on the other leg and close your eyes and balance on that leg. And that will give you sort of a distinct sort of feeling of the difference between normal balance and dyspraxia balance. And then it would also, for the gross motor skills, it would also impact on things like driving a car. So many people with dyspraxia would drive an automatic car, or it might take them a number of attempts to pass their test. And larger activities such as riding a bicycle, activities where you've got to put together a number of different coordination techniques. So that's how dyspraxia would impact on a person.
Very good. Let me tell you, if I stood on one leg, I'd be on the ground and an ambulance would be called.
Well,
Oh,
John, do,
sure.
do you know what, John? That's actually a really important point because dyspraxia or DCD, as it's clinically called, hasn't been diagnosed in older age groups. There would be a number of older people out there who would have significant balance difficulties. And as we know, as you age, falls become more likely. So people in the older age groups with undiagnosed dyspraxia or DCD are in that higher risk category.
So you could have had it all along and not known.
Yes, absolutely.
Wow.
Yeah.
It's a child's disease, is it? Am I right in saying that?
No, it's not, John. It's not a
Okay.
child's disease. That's actually a myth because it used to be called clumsy child syndrome.
Yeah.
So back in the 60s, it was called clumsy child syndrome. And that's where the myth that it only impacted upon children came from. But it actually is a lifelong condition. But with the right supports and interventions, people can manage very well over time. It's only when people are not getting those supports that it can have quite a significant impact on their life. And then in addition to the impacts that I've already outlined to you, you would have secondary impacts such as low self-esteem, anxiety, depression, fatigue, mental health difficulties. So it's
Wow.
really important that people understand that it is a lifelong condition and that supports need to be available throughout the trajectory of an individual's life.
A couple of the signs, common signs that I wouldn't have believed were the likes of sensitivity to touch and organizing routines, delayed speech. I wouldn't have associated that before.
Yes, I mean there are a number of sort of coexisting conditions that sit alongside DCD as well. So up to 40% of the population would have coexisting conditions such as dyslexia or ADHD or autism spectrum disorder. So it can be a combination of those things that could, you know, could make a person more susceptible to smells, touch. It could be the DCD itself. It's very difficult to separate one from the other for certain impacts. So we do try to look specifically at the DCD component, and then if a person needs support around other coexisting conditions, we would refer them on to an agency that can provide those specialist supports.
You mentioned supports earlier and you mentioned it there. What supports are you talking about?
Well, for dyspraxia, the most common supports would be occupational therapy, and that would help the person in relation to developing skills of everyday living. And that could be anything, John, to be honest with you. It might be like we would have requests from children in relation to being able to ride a bicycle or handwriting skills. It could be like we had one young gentleman who had just finished university and was going for his first job interview, and he wanted to learn how to buckle a belt. And so that was an activity that we undertook with him, or our OTs did. And for younger ladies, it might be something like applying mascara. So you can imagine somebody who has difficulty with fine motor skill trying to put on mascara. I know I would frequently make a mess of it myself. So it can be a lot more difficult if if you have poor fine motor skills to be able to do something like that. And that's very important to young people. But for young men to learn to shave, it's very important that they develop those skills for their own self-esteem.
Is there a cure?
No, it's not looked at as in terms of cure. It's in terms of providing supports and services that help the person to develop the skills to live a good life and to live a life that where they can achieve their goals in the way that they want to.
Okay. And do we know how many people have it and what the gender split is?
Yes, so it's estimated that at least one and more likely two children in every classroom would have DCD. And I know when I go into schools and I say to the kids in the classroom, does anybody know what dyspraxia is? There's always somebody in the class who'll say, yeah, I have that, or my sister has that, and sometimes there would be more, like I've had classrooms where there've been 2 or 3 children who've said that they have dyspraxia or that somebody in their family has dyspraxia. So it's very common to come across in schools. And then in terms of the general population, as I was saying, because it wasn't diagnosed in older age groups, we're only starting to see the ages rising now. We estimate that it's about 10% of the population, but it could be higher.
And the reason why it wasn't diagnosed, is it because it wasn't recognized as a condition?
Yeah, that's it. It wasn't recognized as a condition. It was, again, it was, John, you'd remember some of the phrases, as would I, things like, oh, you're like a bull in a china shop, or that you've got 2 left feet, or oh, you can't do anything right, or, somebody who would spill things all over the place or bump into things, break things. So that's how it was sort of looked at. And we would have a lot of older people contact our support service saying, it's such a relief to actually know that there was something wrong that that I can actually put a label on, instead of living with all of these sort of feelings of being stupid and clumsy. So yeah, it's something that we really do try to promote, that it's a lifelong condition, and that for older people, unfortunately, a lot of them have been missed, but it's never too late. So if we have a survey on our website that adults can go to, and it's just a quick quiz where it will give them an indication of whether they should progress to look for an assessment for DCD.
Very good. And when you talk about DCD and dyspraxia, is there a difference between the two, or are they one and the same?
It's one and the same, and that's where people get confused. So dyspraxia is what we call the layman's term for DCD. So if you were to go to an occupational therapist, you would never get a diagnosis of dyspraxia, because there is no such thing. You would get a diagnosis of developmental coordination disorder, and that's what would be written in your report. So you would have a diagnosis of DCD. But DCD is a very fixed term, and it relates very specifically to the fine and gross motor skills and the impact on the individual of fine and gross motor coordination difficulties. Dyspraxia, on the other hand, is the layman's term, and it's a term that is used sometimes instead of DCD, but more often to explain the broader impacts of DCD on the individual. Right. And that's those secondary impacts, such as the fatigue, anxiety, self-esteem, and the other impacts that come from the condition. So really what we would be looking at, John, in an ideal world is for the next diagnostic manual for conditions to include a broader scope for DCD.
Now, you might tell us about Dyspraxia Ireland. When was that founded and why?
So Dyspraxia Ireland was founded 30 years ago. It's a member-based organisation, so we'd have about, across the course of a year, 400 to 500 members, and they're located all across Ireland. We have members in Northern Ireland, in the UK, in Australia, Canada, and America. So although we are a national organisation, we do have members from other countries as well. And we provide a range of services. So we provide clinical services. We have 3 occupational therapists that work for us. And they provide diagnostic assessments and then following support services as well. We have a really busy guidance and support hub. So that's where people contact us through our website. And the questions are, they can range from, my child's just been diagnosed, what do I do next? To, I'm having problems with my employer, what should I do? Or I feel that I can't speak to my partner about the diagnosis. We both have different ways of dealing with our child, or what's going to happen to my child in the future. So there's lots and lots of questions, mostly concerns that would come in through our guidance and support hub, and we respond to those and provide supports and resources to people that way. We have online groups and activities for teenagers. We've got our Songwriters Club, which is a music therapy program for teenagers. We have our book club. We have a Carja Club. We have a lot of activities in person during the year. So we would have sort of days out and family days and things like that. And we've got an excellent counselling program, and that supports a lot of the people who come to us through our guidance and support hub.
Very good. That's a busy unit
We
that
are
you
busy.
run.
Yeah, we're very busy, John.
Yeah, I read your website, and all of that is on your website,
It is.
plus a bit more, and it's very, very full of very useful information. I see that you do educational training. What kind of subjects are they?
The educational training's really taken off in the last year or so. So the government has provided employers with work access grants. And that's, if there's employers listening, I would really encourage you to look into those grants. They're designed to try and increase Ireland's percentage of employees with disabilities. We're 4th lowest in the EU at the moment. So we've got a bit of a dismal record in that category. So the government has introduced a whole range of grants for employers. And so we would work with employers around, it might be education in terms of neurodiversity. It might be in terms of setting up equitable job application systems and interview systems. It can be really whatever the employer needs support with. Sometimes mediation if things are getting a little bit difficult between the employee and the employer. But then we also refer out to other employment support organisations as well. So that's a growing piece of work that we're finding a lot of requests coming in for at the moment from employers, and we're always very happy to work with them. And we really appreciate employers who contact us, because it's, as I said, it's an area that Ireland really needs to improve in.
Very good. How do you become a member? I know you have loads of members, but how do you become one?
Very simple, John. You sign up online on our website. Our membership fee is €40 per year. Once you sign up, you are able to avail of a range of discounts on services, on workshops, to our national conference, to purchases through our bookshop. And so the benefits of becoming a member are, they're just very high. Plus, we send our members newsletters, and they get first access to any training or events that we run.
Very good. If there's somebody out there who's just got a diagnosis, their child has just got a diagnosis, what advice would you give?
I would say to them, if your child's just got a diagnosis, don't jump straight away into fix-it mode. Take some time to let it process. Don't don't think that you've got to fix everything immediately. I would say get in contact with us. We have a range of resources for families whose child has just been diagnosed, and we can help you through that process because it's an emotional one. It can be very confusing. It can be very frustrating when parents aren't getting the supports that they need. So please do contact us and we will help you through that journey. That's what we're here for. It's to walk with you on that journey and to help you and your family.
And don't go to Dr. Google.
Don't go to Dr. Google. That's correct, don't.
Because they'll just tell you about the illness or the condition. They won't tell you how to manage it.
Yeah, so that's actually very important. So all of our services and supports are evidence-based, and we're very careful about that. And we're involved in a lot of research. We partner with universities. So it's something that, we're very careful to ensure that everything that we have on our website and all of our services are person-centered and evidence-based.
Now, before we go, have you anything else you'd like to put out there?
Yeah, I would just like to say, I mentioned our occupational therapy services. So we have been funded by the HSE to address waiting lists for children across the country. And as many of your listeners would know, there's quite a chronic wait list issue at the moment. So if you are a parent of a child aged between 8 and 13, and you're on a HSE wait list anywhere in the country, you can go to our website, www.dyspraxia.ie, and you can click on the link for our POTS program. So that's POTTS, which stands for Partnering in Occupational Therapy Telehealth Services. And you can register your interest there. And we are funded by the HSE to undertake assessments and follow-on support services with families across the country for children in those age ranges. So I think it's an amazing initiative. It's something that we've been rolling out for the past couple of months, and we hope to roll it out in other parts of the country as well. We've got a service specifically located in the West, but we do take, as I said, referrals from all over the country. But we would like to have another site, probably down south towards Cork, that area. So yeah, do get in contact and we can tell you more information about that.
That's huge.
Yes, it
That's
is, John.
really, really huge. And I would imagine if I was a parent, I'd find it very, very useful.
Exactly, yes. So listen, all I can say is go to the website. There's so much information there. We also have a lot of videos on our YouTube channel. We have social media pages. So there's lots of ways that you can find out what we do, the information that we provide. We keep everything up to date. So please do get in contact with us. As I said, that's what we're here for.
Brilliant. Sharon Lane, thank you so much for talking to us at Disability Matters.
John, it was an absolute pleasure as always. Thank you so much and have a lovely day.
It was
Take
my
care.
Pleasure.
Thanks, John.
All the best.
Bye.
We'll be in touch soon, right?
Okay. Happy Christmas
luck.
as well.
You too.
Bye.
Bye.